From CBS 4, this is Aging Independently with Christine Bartel, empowering seniors to live on their own terms in their own homes. Sponsored by Amedisys Home Healthcare, caring for your loved ones as we would our own.
Hi everybody, and welcome to our show. Speech and language disorders are caused by many conditions like stroke, Parkinson's, and dementia. It can dramatically impact the quality of your life, but there is help. Speech and language therapy is doing wonders for patients with swallowing, cognitive, and communication problems.
Because I've spent most of my life cooking. I was a chef in a hotel. Mealtime, such a family event for, I think, everyone. And that's gone. The whole quality is just gone. In March, I had septic streptococcal pneumonia and ended up spending 3 weeks in an ICU, intubated on a ventilator. And when I left, I had no swallow and no speech and a peg feeding tube in place. And I was losing weight. I couldn't take medications that I needed to take because they could not be crushed and put down the tube. I was really getting pretty desperate. And asked my doctors to write a referral to Charter.
Swallowing therapy has changed tremendously in the 20 years that I've been practicing speech pathology, and we've just recently, in the last 10 years or so, been able to use electrical stimulation, which to me has dramatically changed the progress that my patients make. I did an evaluation and was able to see which muscles in Joanne's throat were weak, and was then able to do electrical stimulation to try to strengthen those muscles specifically.
And even after the first week, I could tell a difference in progress.
The best part about my job is when I get to be able to tell somebody that they can go back to eating something, they can go back to drinking water. Swallowing difficulty does not have to be a part of life.
I am now able to swallow and eat anything I want.
It's kind of a miracle.
My doctor thinks so as well.
Lisa Rowell is the Area Rehab Director with the Amedisys Home Healthcare. Thank you for being here, Lisa.
Thank you, Christine.
Today we're going to talk about speech therapy and what the scope of practice is and what we can do to improve conditions associated with that.
Exactly. I think it's well known what a physical therapist and an occupational therapist might do, but there are also speech-language pathologists that work in outpatient settings or in home health care that have a large scope of practice and work with a large clientele of patients, especially those that might be suffering from Parkinson's, MS, or maybe just post-stroke.
And these speech therapists, there should be an order for home health care. They come in, and what do they do? What do they work on, and how do they do it?
Good question. First, you want to talk with your doctor. Tell them what you might be having trouble swallowing. You might be having trouble talking to your family on the phone. Maybe your voice isn't strong enough and it's not loud enough. You don't have that breath sound with that. Or you might be having trouble remembering things as well. And if those are signs and symptoms that you see, talk to your doctor, and a speech-language pathologist can come in and do an assessment on you to see where your most areas of need are, and then how do we cope with that or treat it, and make a plan of care for you.
Right. And it's really important to know that there's some aggressive speech therapy that includes VitalStim. Explain that to me.
Yes. VitalStim is used a lot with folks that might be suffering from a swallowing disorder. It would be some pads that go around your neck on the muscles and provide some stimulation or feedback to help retrain those muscles on how to swallow properly in the most efficient way to get that food cleared. It's important because if you're not clearing that food or water very well, you set up your risk for aspiration pneumonia, and that can lead to other issues as well. So those are things that speech therapists might be looking at in the home.
Okay. And a lot of people, like you said, they see physical therapy, occupational therapy, and nursing as important, but speech therapy is imperative to recovery.
They work in a large team along with us. You know, we work together as a team to try to get you to where you want to be and meet your goals, be able to communicate with your family. Great.
Thank you so much for being here.
Thank you.
For more information on your home health care options, call the Amedisys Information Line at 1-877-877-8145. You can always go to our website for more information, to take today's poll question, and learn more about aging independently by watching all of our shows. Just head to cbsdenver.com and click on Aging Independently. Be sure to join us next time for more information on staying independent in your home.
Thank you for watching Aging Independently with Christine Bartel. Sponsored by Amedisys Home Healthcare, caring for your loved ones as we would our own.